Hi, it's Dr. Motwani here at Motwani LASIK Institute. We're in the laser room, the surgery room, the operative room. This is where the magic happens. And right now we're going to answer the question of how long does the procedure take and how quickly will I be able to see after it. How long is usually not very long. You're in the room 15 to 20 minutes. The real time is dependent on two things: laser and surgeon. Quicker surgeon, quicker setup, gets you out of the room faster. For example, I'm one of those people that firmly believes that the more time you're underneath here, the more time the cornea is open, the more stress it is for the patient, the more stress it is for the tissues, the longer it takes to heal. The laser time, so the surgeon makes a difference because how quickly a surgeon moves and how efficiently things are set up means you're going to have to spend less time in here. It takes me a couple of minutes per eye. You're in the room 10 to 15 minutes total. Laser time is a big deal. This laser is probably about 4 to 5 times as fast as a Vizx laser. That means most laser times 10 to 20 seconds. That's pretty dang fast. That means if it takes me a couple of minutes to make a flap, 10 to 20 seconds to do the laser, or you're in and out of the room in about 15 minutes. How quickly can you see? Many of our patients will actually see some pretty quickly after the procedure. It's kind of like you're underwater. Some patients will actually start seeing almost as well as their contacts 10 minutes later. We can't count on that. What I tell patients is by the next morning you should be able to see well enough to go to work, go to school, drive your car, do the basics of everyday life by the next morning. Some patients are faster. I've had patients walk out of here and go, holy cow, I can almost see as well as my contacts. But we say about 6 hours of kind of discomfort. We give you something to make you sleepy. Discomfort like scratchy, burning, tearing eyes. We'll give you something to make you sleepy. If you sleep through it, then that does not become a problem. The discomfort's gone. By the time you wake up, it's starting to clear. By the next morning, you can kind of get back to things. That's pretty cool. You don't really miss a lot of downtime. You don't have to take a lot of time off work or anything like that.